Good evening, gentlemen. I'm Dr. Carolina. Tonight, I want to talk about a topic that often causes unnecessary fear, confusion, and sleepless nights for many men: PSA levels. You might have had a blood test recently, and your doctor mentioned that your PSA was a bit high. Instantly, your mind jumps to the worst-case scenario: prostate cancer. But before you panic, I want to reassure you, a rise in PSA doesn't automatically mean something serious. In many cases, it's temporary, natural, and completely fixable. PSA stands for prostate-specific antigen. It's a normal protein made by your prostate gland. Every man has it, and it's supposed to be there. The problem isn't PSA itself, it's how we interpret it. Think of PSA as your body's check engine light. When it blinks a little higher than usual, it's simply signaling that your prostate may be irritated, stressed, or reacting to something in your routine. Most of the time, that something is small: a bit of inflammation, dehydration, or even timing. Over my years as a urologist, I've seen hundreds of men walk into my office anxious because their PSA jumped slightly from one test to the next. After talking through their habits, we often discover that the cause was something as simple as a long bike ride, a recent exam, or not drinking enough water. The good news is that once those factors are managed, PSA usually drops right back to normal. Let's start with one of the most common causes: mild inflammation or irritation. Your prostate is a small gland, but it's sensitive. When your body is dehydrated, when you're constipated, or even when you spend long hours sitting, pressure builds in the pelvic area. That irritation can cause the prostate to release a little more PSA into your bloodstream. It doesn't mean anything is seriously wrong, it's just your body reacting to stress. The fix is surprisingly simple. Hydrate consistently, move your body every hour, and include anti-inflammatory foods in your diet. Foods rich in omega-3 fats like salmon or walnuts, as well as vegetables like spinach, broccoli, and tomatoes, help calm internal inflammation. A glass of water every couple of hours, light stretches during work breaks, and standing instead of sitting for long stretches can help the prostate relax and function normally again. The second common cause is sexual activity before a PSA test. Ejaculation naturally releases PSA because the prostate produces part of the fluid that becomes semen. So if you have sexual activity within 48 hours of your blood test, you might see a temporary spike. It doesn't mean your PSA truly went up, it's just a timing issue. I always tell my patients to avoid sexual activity for 2 days before testing to get an accurate reading. It's a small adjustment that can save you a lot of worry later. Next comes exercise. And this one surprises a lot of men. Intense physical activity, particularly cycling, rowing, or anything that puts prolonged pressure on the pelvic area, can irritate the prostate. Even long car rides or sitting on hard surfaces for hours can have the same effect. If you have a test coming up, avoid vigorous lower body workouts and cycling for 48 hours beforehand. If you're an active cyclist, consider a seat designed to reduce pressure on the perineum. Little things like this can make your PSA reading much clearer and more accurate. Another common cause is dehydration. This one's simple, but often overlooked. When your body is low on fluids, your blood becomes thicker, and your organs, including your prostate, have to work harder. That stress can slightly raise PSA. Dehydration also irritates the bladder and urinary tract, which can make the prostate more reactive. The solution? Spread your water intake throughout the day. Don't wait until you're thirsty at night to catch up. Aim for steady hydration, most of your water before 4 p.m., then taper off gently in the evening. It helps your kidneys, your bladder, and, yes, your prostate. The fifth cause is something you might not connect right away: recent medical exams or procedures. If you've had a rectal exam, catheter use, prostate biopsy, or even a scope test in the bladder area, your PSA can rise temporarily. That's perfectly normal. The manipulation or pressure on the gland releases PSA into the bloodstream. It usually takes 4 to 6 weeks for levels to settle. That's why I always recommend waiting that long after any procedure before retesting. Otherwise, the number might look higher than it truly is. Next, medications and supplements. Some medicines like testosterone therapy, cholesterol drugs, or blood pressure medications can affect PSA readings. Others, like finasteride, actually lower PSA artificially. And then there are supplements, testosterone boosters, herbal mixes, or energy pills that can stimulate hormone activity and change how the prostate behaves. This doesn't mean you should stop your medications. It means your doctor needs to know exactly what you're taking. It's part of the full picture. When we have that context, we can interpret your PSA correctly and avoid unnecessary alarm. Finally, the seventh factor, your overall lifestyle. A poor diet, lack of movement, and chronic stress all contribute to low-level inflammation that can elevate PSA over time. Diets full of processed meats, sugar, and fried foods create oxidative stress. Long hours of sitting slow down blood flow to the pelvis, and when you're constantly under stress, your body produces more cortisol, the stress hormone that raises inflammation throughout your system. All of these combined can nudge PSA higher without any disease being present. The fix here isn't complicated. Shift toward real, whole foods. Add color to your plate, green vegetables, berries, nuts, seeds, and lean proteins. Limit alcohol and processed foods, especially at night. Move your body throughout the day, not just at the gym. Even standing and stretching every hour helps maintain pelvic circulation. And most importantly, manage your stress. Whether it's through deep breathing, meditation, prayer, or simply taking quiet walks, give your nervous system time to reset. The calmer your body, the calmer your prostate. Now let's talk about the bigger picture. PSA isn't a diagnosis, it's a signal. It tells us something in your system might need attention, often something simple. It could be dehydration, a long drive, or a recent workout. I like to remind my patients that one PSA number is just a snapshot in time. What really matters is the pattern. We look at trends, not single moments. So if your PSA rises slightly, don't panic. Recheck it in a few weeks under more stable conditions. Well-rested, hydrated, and with no recent sexual activity or heavy exercise. You might be surprised to see it drop right back to normal. There's something powerful about understanding your body instead of fearing it. Knowledge reduces anxiety. When you know that PSA fluctuations are often lifestyle-driven, you stop assuming the worst. You start seeing your body as an intelligent system that's always communicating with you. Those numbers on a lab report are part of a conversation, and now you know how to listen. So what can you do to support your prostate every day? Eat for balance. Choose anti-inflammatory foods like pumpkin seeds, green tea, tomatoes, berries, and fish rich in omega-3 fats. Hydrate wisely. Drink water steadily through the day and limit alcohol and sugary drinks that cause irritation. Move your body every hour. Even light activity helps blood flow and keeps the pelvic area oxygenated. Get 7 to 8 hours of real sleep each night because hormone balance depends on rest. And when you get your next PSA test, remember to prepare for accuracy. Skip ejaculation, avoid cycling, stay hydrated, and let your body be calm. Gentlemen, your prostate is resilient. It responds to care, to attention, and to patience. A temporary PSA rise is not a sentence, it's a message. When you make small adjustments in hydration, movement, nutrition, and stress, your body listens. Within weeks, you may see not only better test results, but also better energy, mood, and clarity. I've seen it countless times. Men who walked into my clinic worried and left empowered because once they understood that PSA is a signal, not a verdict, everything changed. They took control of their health instead of being controlled by fear. If there's one takeaway I want you to remember, it's this: track patterns, not panic. Your body gives you feedback every day. Learn from it. Respond to it with care, not fear. A high PSA today doesn't define your health. Your habits do. So tonight, as you wind down, take a moment to reflect on how you've cared for yourself this week. Did you hydrate? Did you move? Did you rest? Each of those small steps supports your prostate and your peace of mind. If you found this message helpful, give it a like so it can reach more men who need this reassurance. Subscribe for more practical, science-based advice on men's health, energy, and vitality. I'm Dr. Carolina, reminding you that awareness is power. Your body is not against you. It's speaking to you. Listen closely, take small, consistent actions, and you'll be amazed at how quickly it responds. Take care of your prostate, take care of your peace, and trust that your body knows how to heal when you give it the chance. Good night and stay well.